when dysregulated, if we are over aroused or under aroused, we are not functioning at our best, which means I might be able to interact with you in one way, in one scenario, and another day, in another scenario, my interaction with you might look very different. My behavior in the classroom might look very different on Tuesday as opposed to Friday. My behavior might look different if I'm in the classroom versus when I'm at home. So I just wanted to kind of have this reminder as we go into the next slide. It's just a chart. I know there's a lot of words, but what we do know is that the overlap has nothing to do, whoopsie, my apologies. Behaviorally defined symptoms do not give us insight into the cause of those symptoms. So here I'm highlighting how difficulty with social skills falls in both categories of autism and trauma. And neither one gives us an understanding of why a person is having trouble with social skills. So relationships can be challenging regardless of the diagnosis. For folks who've experienced relational trauma, relationships have proven to be unsafe in the past. So social skills rooted in relational connection, getting close to somebody beyond that superficial interaction, can be really challenging. In fact, people who have complex or developmental trauma tend to be really sensitive to nonverbal communication and respond to that before given the chance to explore that information cognitively. So again, the information gets interpreted before we are able to process it with those more complex thinking skills. And I liken it to touching a hot stove. So if we touch a hot stove, we are not allowing our brain to utilize that information long enough to be able to sit and use our complex thinking skills. We're not thinking, okay, if I leave my hand on here, I'm going to get injured, and then I'm going to have to go probably to the hospital to get treated. Then I'll have to miss work, and I can't afford to do that. We're not doing any of that. We're just moving our hand away. Our body is responding before we're even thinking about it. And so sometimes social skills for people with complex trauma can be very similar. They see a certain look on somebody's face, or they hear a certain tone in somebody's voice, and they were responding. Their body is responding. They're having feelings, or they are having automatic thoughts that are not using those complex parts of the brain. They are more automatic, they are more reactive, and they are more emotional in nature. So you can see then how some of those patterns of responding can be similar to those with autism. And so if somebody comes into the office having trouble with social skills, that does not give me enough information by far to be able to understand what I'm looking at. We also know that restricted and repetitive behaviors can serve to be anxiety reducing. For those who've experienced trauma, life has been unpredictably dangerous, and increasing the amount of predictability in their environment can help to reduce anxiety as well. So things like disconnecting to their lived experience in that moment, having what we might think of as odd or eccentric practices or rituals that they do, that could be related to anxiety, that could be related to autism, that can be related to traumatic responses to, I need to feel some sense of control in my life, and so I'm going to maintain this ritual because it's something I'm comfortable with. I can predict it and I can control it. Furthermore, following exposure to trauma, kids may exhibit concentration difficulties, regression in their daily skills, so their hygiene might decrease, their ability to follow through, their concentration might decrease, an increase in the levels of repetitive behavior. Again, you're seeing this overlap happening.